Yes.
Good morning, Mr. Smith. My name is Shannon Smith. You can call me Shannon. I'm a nurse practitioner student at George Washington University. I will be doing your exam today.
Okay.
Alright, I'm just going to wash my hands here before I get started. Do you have any questions or concerns?
No.
No? Okay. I'm just going to note, before I get started with your exam, your overall appearance, your hygiene, your mood, facial expressions. And then I'm going to start by inspecting your head. I'm going to look for any scars, lesions, moles. I do note that you have a scar there on your chin. I'm going to look for facial symmetry. I'm going to come take a look at your scalp. I'm going to inspect for any scaliness on your scalp. Good. I'm going to feel the texture of your hair. I'm going to notice the pattern and distribution of your hair, in addition to your eyebrows and your eyelashes. I'm going to then palpate your head for any areas of tenderness or pain. Does that hurt at all?
No.
I'm going to feel for any depressions in your skull.
Okay.
Okay. I'm going to come forward here. I'm going to palpate your sinuses. Does that hurt at all?
No, it does not.
Okay, excellent. I'm going to then palpate your temporal arteries, feel for any thrills. I'm going to have you open and close your jaw. Does that hurt at all?
No.
I don't feel any clicks or pops. Then I'm going to test your facial sensation by touching you there and there. Does that feel equal?
It does.
Good. Does that feel equal?
It does.
And there and there.
Yes.
Excellent. I'm going to have you do a few things for me then. I'm going to have you smile, frown. Why don't you puff your cheeks out, and then I'm going to have you just wrinkle your forehead. Good. Excellent. Last, I'm just going to listen then to your temporal arteries with the bell of my stethoscope. Good. Excellent. Next, I'm going to examine your eyes. I'm going to again look for symmetry of your eyes and position. I'm going to note for any drainage, swelling, the color of your eyes. I'm going to just inspect your lacrimal ducts and your conjunctiva by pulling down here and looking up. I'm going to look at your sclera. Everything looks good. I'm going to palpate your lacrimal ducts and around here. Does that hurt at all? Any pain?
No pain.
Okay. We're then going to test your vision. Do you have any concerns with your vision? Do you wear glasses or contacts?
Do not.
Okay. I'm going to start with this vision chart, 14 inches from your face. I'm going to have you read with both eyes the smallest line you can.
428-739.
Okay, and then close an eye.
428-739.
Good, and the next eye.
428-739.
Okay, great, good job. All right, I'm going to then have you look right at me. I'm going to wiggle my fingers and you're going to tell me when you can see them.
You can see them? I can see them. I can see them.
Okay, good. And I'm going to then have you keep your head looking forward and just follow my finger with your eyes. Good. Then watch my finger here and follow it in. And out. Excellent. I'm going to just turn off the lights or dim the lights for the next part of the exam here. Excellent. Alright. I'm going to use this flashlight here. I'm going to have you stare at my nose and I'm just going to shine it in your pupils here. I'm looking for them to react to light. I'm looking at the size and shape of your pupils. Good. I'm going to then do your eye exam. I'm going to have you look straight ahead.
Okay.
Good. And I'm going to just touch above your eye here. Keep looking straight ahead and I'm going to shine this light in. Bring it forward. I'm looking for the red light reflex and I'm noting your optic disc margins. Okay. I'm going to come around here and do the same thing. Excellent. Next we're going to check your hearing. Have you had any problems with your hearing? Any concerns at all?
No.
Okay. I'm just going to look at your ear. I'm going to inspect your outer ear for redness, any swelling, drainage, lesions. I'm going to palpate your tragus, your pinna, and your helix for any pain. Does that hurt at all?
No.
Okay. I'm going to inspect inside your ear. Okay. I'm going to just pull up and back. I'm going to put this otoscope in your ear, so tell me if that hurts at all. And I'm just going to take a look here. Okay, good. I'm looking for the cone of light, and I saw that. I'm going to again do the same thing on this ear. I'm going to note any redness, swelling, drainage. I'm going to assess for any pain by palpating around your ear. Does that hurt at all?
No.
Okay. And then I'm going to take a look inside your ear. Okay, good. Next we're going to test your hearing. I'm going to say a series of numbers, letters, and I'm just going to have you repeat those to me. Then I'm going to have you block your ear with your finger and just kind of wiggle it around. Then I'm going to go stand about 2 feet behind you here.
Okay. 3, 2, 1.
Okay, great. I'm going to do the other side.
3, 2, 1.
I'm going to further test your hearing with this tuning fork. I'm going to place it on top of your head, and I'm going to ask you, can you hear that?
I can.
Is it equal on both sides?
Yes.
Okay, good. We're going to do another hearing test. On this side, I'm going to put the tuning fork behind your ear and ask you if you can hear that.
I can.
You hear that?
Yes.
Okay. Tell me when you stop hearing that.
Can't hear it anymore.
Okay, can you hear that now?
Yes.
Okay, good. And do the same on the other side. Can you hear that?
I can hear it.
Tell me when you stop hearing it.
I can't hear it anymore.
Okay, can you hear it now?
Yes.
Okay. Next, we're gonna inspect your nose. I'm just gonna look at your nose, note the symmetry, any swelling, any drainage. Look at your nasal septum to see if there's any deviation. I'm gonna just gently push up on your nose here and take a look with my light. Notice any erythema, or redness, any polyps or swelling. Good. Then I'm gonna have you take a finger and block one of your nostrils, take a breath in, and do the same on the other side. Any difficulty with breathing on one side? No? Okay, I'm gonna have you close your eyes. I'm gonna wave something in front of you here. Can you smell that?
Yes, I can.
What does that smell like?
Smells like alcohol.
Okay, good. You can open your eyes. For the next part of the exam, I'm just gonna inspect your mouth. I'm gonna put gloves on for this part of the exam. I'm gonna first start by looking at your lips, notice any cracks, lesions, or anything like that. And then I'm going to look inside, bless you,
Thank you.
inside your mouth here. Maybe open up for me. Good. I'm gonna look at your gums. I'm gonna look at your teeth for any dental caries. I'm gonna push on here, your teeth a little bit and see if there's any loose areas, which I don't notice. I'm gonna have you stick your tongue out. Say ah for me. I'm looking for your soft palate to rise. I'm looking at your tonsils. I don't notice any exudates or swelling. Good. I'm gonna then quick examine your tongue here. Have you stick your tongue out and wiggle it back and forth for me. Good. And I'm just gonna grab it here and look underneath it for any lesions. Good, I don't notice any. Any problems swallowing?
No.
Okay, any hoarseness in your voice that you've noticed?
No.
Excellent. Next I'm going to inspect your neck here. Have you look up at me. I'm gonna note any swelling or masses on your neck. I'm gonna look at your trachea and note for any deviation of your trachea. And I'm gonna just palpate here. I'm gonna push on it on one side and the other side. Good. And I'm gonna palpate your thyroid gland, thyroid isthmus, and see if I can feel any lobes of your thyroid. Have you swallow for me? Okay, good. I'm gonna come back around here and feel again, and I'll have you swallow. Okay, good. Next, I'm just gonna feel your carotid pulses. And I'm gonna palpate your lymph nodes. And I'm just gonna have you tell me if there's any areas that are tender or sore.
Mm-mm.
Okay. Okay, does that hurt at all?
No.
Anything like that? Okay, excellent. Next, I'm just going to take a listen here to your carotids with the bell of my stethoscope. I'm gonna have you take a breath in and hold it. Good. Breathe out. And take a breath in and hold it. Good. I'm just gonna do some range of motion here. I'm gonna have you turn your head towards my hand. And again, towards, okay, good. Shrug your shoulders. Excellent. And then I'm gonna have you look up and down. Touch your chin to your chest. Look side to side. And then put your ear to your shoulder. Does that hurt at all?
No.
Any pain there? Excellent. I am next going to do your lung exam, so if you could remove your shirt, that would be great. Take that for you. Good. Alright, I'm going to inspect your chest. I'm going to note the rate, rhythm, and ease of breathing and your retractions on your chest. I'm going to look at the AP diameter of your chest. I'm going to start with the posterior exam by inspecting for any trauma, any bruising, any swelling, scars, lacerations. I am then going to find where your ribs start, so I'm just going to palpate up here. Good. Palpate up again. Good. I'm going to palpate your back for any areas of pain or crepitus. Does that hurt at all?
No, it does not.
Okay. And I'm going to have you just take a breath in. I'm noticing your lung expansion and another big breath. Excellent. And then have you say 99 for me.
99, 99, 99, 99.
Excellent. And then I'm going to percuss, so I'm just going to tap on your back here. And then I'm going to kind of measure where your diaphragm is by having you take a deep breath in and hold it. Okay, and breathe out. Alright, and then I'm going to have you take a deep breath in and blow it out and hold it. Okay, good. Excellent. Next, I'm going to listen to your lung sounds here in various locations. So I'm just going to have you breathe in and out through your mouth for this part. I'm listening with the diaphragm on my stethoscope. Breathe in and out. Good. I'm going to have you then say the word E.
E.
As I move my stethoscope.
E. 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 E.
Excellent. And I'm going to have you say 99.
99, 99, 99, 99, 99, 99.
And then go ahead and whisper 99.
99, 99, 99, 99, 99.
Okay, good. And why don't you go ahead and lie back here for me? Again, I'm going to assess the front of your chest here. Notice the rate and rhythm of breathing. I'm going to feel for where your ribs start by just palpating up. Good. Good. Palpate your chest for any areas of pain here. Any of that hurt?
No.
Okay, good. And then I'm going to have you say 99 for me.
99, 99, 99.
Excellent. And then I'm going to tap on your chest again here. Excellent. I'm going to listen in various locations. We're going to repeat it like we did in the back of your chest. Breathe in and out through your mouth. Okay, and then go ahead and say E.
E. E. E. E. E. E.
Okay, and 99.
99, 99, 99, 99,
Excellent. All right, next we're gonna inspect and assess your heart. I'm gonna start by having you take your neck and turn it to the left there. And at 30 degrees, we're just gonna assess for your jugular vein distension. Okay, and then you're gonna assess or inspect your chest for any heaves or lifts. Okay, which I don't notice. I'm gonna then palpate here, feeling for any heaves or thrills. Okay, then I'm gonna palpate also for the point of maximal impulse. I'm going to listen to your heart in various locations, again, with both the bell and the diaphragm of my stethoscope, starting with the diaphragm. I'm going to listen here in the aortic area, the pulmonic area, at Erb's point, your tricuspid area, and the mitral area. I'm going to flip my stethoscope over and do it again. I have you roll on your side, and I'm just going to listen in the mitral area for any third and fourth heart sounds or any mitral murmurs with the bell of my stethoscope. But you can roll on back. I'm going to just help you sit forward here. Okay, and again, we're going to just listen in various locations, starting with the diaphragm. You can just breathe normal for this part. Okay, and then in the tricuspid area, I'm going to have you just lean forward, have you take a breath in and hold it. Good, and you can breathe out and sit back up straight. I'm going to listen with the bell of my stethoscope. Okay, and that concludes our exam today. Great job. Do you have any questions?
No, I do not.
All right, well, have a great day.
Thank you.
Thank you. Just going to wash my hands here before I leave.